Welcome, everyone. I'm so excited today. Our guest expert is an allergist and integrative immunologist and a world-renowned functional medicine specialist. He's also a best-selling author, and he combines his vast knowledge of allergy, clinical immunology, and hormone imbalance syndrome to get to the root cause of diseases. So I'm excited to have you here. Thank you so much. I'm introducing Dr. Benoit Tano. Thank you for being here.
Thank you very much, Sarah.
So can you tell me, how is your practice different than going to a typical immunologist with some hives?
Okay, so I think I would give you a little bit of background.
Okay.
Because I think that may help us enlighten people a little bit. So I'm trained hardcore allergist, traditional allergist at Johns Hopkins. And my road to treatment has changed a little bit from traditional allergy because I'm an academician. Actually, I like to teach. So when I finished my fellowship, I had a position in Texas. And while I was there, I went to a meeting. And that meeting actually changed my life completely. It's a group of ENT physicians and family physicians who get together every year, and they do allergy skin testing. They learn how to do that, and they introduce allergy in their practices, and they do that in 5 days. So I was not really enthused with that because here I am. I did 2 years after internal medicine residency. I did 2 years of allergy and immunology training before I can call myself allergist, and these people did that in 5 days.
Right.
So, but what I liked was one person did a presentation on hormones and how hormones affect our bodies and how hormones do this, hormones do that. I said, whoa, why didn't I learn this in medical school? Why didn't I learn this in residency? And why didn't I learn this in fellowship training? And plus this group, I don't trust them. They do allergy in 5 days. Maybe I should go and learn about hormones. So I went and bought all the hormone books literally on the market and started studying them. And the more I studied, I found out, wow, that's amazing how the hormones actually affect a lot of allergic diseases that we treat and we don't even know. So then I proceeded to relate the hormone imbalance to allergy in women. So because many women show up probably age 30, 35 or so. So, well, I didn't have allergies before. Now I'm having allergies, I'm getting asthma, I'm having eczema, I'm having all these allergic diseases that I didn't have before. And so, well, there might be something with the hormones. So then when I found out that the hormones were part of it, I started to write about it. And that's how my treatment started changing, because my process of finding out hormone imbalance affect allergies drove me to understanding more of why women are having so many of these things that they didn't have before, and now they're having it. So when you ask how my process is different from other allergies, that's how it differs, because I learned more about how things can affect the body differently. And biologics play a major role.
Okay, well, that's definitely a big part of and what we experience. I mean, a lot of us, we notice, different fluctuations in our symptoms around our cycles, or some of us, our hives will go away during pregnancy. Others, they have hives that start during pregnancy. So it's really interesting, that hormone connection. Can you talk a little bit about how the hormones are playing into our chronic hives?
Okay, so I would think that chronic hives, actually, if you look at it, there are several factors that drive it. Mm-hmm. And I put them in a category, I call it TBN. So TBN, toxins, biologics, and nutrient deficiencies. Those are the 3 major things that drive the hives. But unfortunately, many times when we look at it, we don't look at the different parts. So we just say, oh, it's IgE mediated. As allergists, we think it's IgE is the major thing. And if you look at all the major treatment that we have, they gear towards the IgE, like the biologics, Xolair and the new ones, ligelizumab and all of these things. They're all targeting IgE. They're not looking at the other factors that may impact the hives. So one of the major toxins, let's talk about toxins. Our body has immune cells, right? And those immune cells, we have them, I think we have probably 5 different group of cells that I'm going to talk about. One of them, I call it they call them antigen presenting cells that I call them patrolmen. They're like policemen of the body. So when we eat foods and the foods are contaminated with pesticides, so how do the cells react? Well, the patrolmen, they pick up that food and they think it's dangerous. So what they do then, they take it to their friend. They sample it, they chew it up, and then they take it to their friend that are called Superman. Because that Superman, he can go 2 ways. He can go several ways, not more than even 2. And he looks at it, he says, well, this is dangerous. We have to attack it. So that Superman takes it and then tears it apart and then signals to the bomb-making guy. The bomb-making guy then makes bombs to try to destroy whatever it doesn't like. And so some of these bombs, that's what causes what we call autoimmune disease. For me, there's no such thing as autoimmune disease because the body is not really crazy. The body does not attack itself as such. What the body is attacking is things that it does not like. Things that it doesn't like, that's what it's attacking. So if you have toxins in you, the body is going to try to attack the toxins. So it makes the bombs to go to attack the toxins. So those bombs then will go and attach to the chemicals or the bacteria or whatever it doesn't like, and then it forms complexes. So those complexes then circulate in the body and lodge in the small vessels and form inflammation. And that inflammatory process is what we see as reactions. Now, some of those bombs also will go and attach to 2 cells. One of them is called mast cells. And when the bombs attach to the mast cell, they cause the mast cell to degranulate, meaning pouring out its internal contents, which would be like histamine or leukotrienes or prostaglandins and all of those things that cause reactions. Many times we talk about mast cells as the villains, but it's not only mast cells. We have the basophils. The basophils, they live in the blood itself. And the mast cells live in the tissues. So those 2 cells are the ones that create the histamine and leukotrienes and prostaglandins that lead to reactions such as hives. So you were asking me about how the hives come to be. So the toxins actually cause hives through the reaction to the 5 cells that I have talked about. Now, when we have biologics, for instance, some of the environmental toxins, they are estrogenic, they mimic estrogen, they mimic hormones. So those estrogens, they also have receptors on the mast cells and the basophils. It's called estrogen receptor alpha. So when they attach to the receptor, they cause histamine and leukotriene release. And so then we're going to have reaction. And that's probably why women have more reaction in terms of hives than men. So when you look at it, we have more women who have hives. My thinking is anything that has a predilection for women, let's think hormones. Mm-hmm. And so probably the estrogen component leads to a lot of hives that we don't even take into account, because when we do traditional allergy, we really don't do hormone evaluation and management and all of these other stuff. So we're not getting to the root cause of the problem. The estrogen receptors, they are on the basophils, they do the same thing, and they're causing the hives. So we should be looking into it. Sometimes when we have nutrient deficiencies also play a major role. Mm-hmm. For instance, a lot of times you see that women who have the hives, they also may have thyroid disease. They may have like Hashimoto's thyroiditis or inflammation of the thyroid. Well, the Hashimoto's, has a predilection for women. You wonder why? Well, there's a hormonal component to it, but also nutrient deficiency component to it. Now, one of the major nutrients is iron. For instance, if you have iron deficiency, your thyroid is not going to work. So a lot of women, they do have Hashimoto, they have the low thyroid, they're on levothyroxine or some of the thyroid medications, but they're not looking at nobody's checking the ferritin or the iron stores. So then they're lacking iron. And when they're deficient, that leads to low thyroid. And the thyroid is not working, that leads to the hives, and nobody knows why they're having the hives. So you have to look at the whole big picture. I think my background actually allows me to do that, because I don't know if you know this, but I'm an economist by training. So I did economics before I went to medical school. I taught economics for 7 years before I went to medical school. Now, because of that, when I see patients, I look at things globally, what we call macro. So I get a macro view of the problem, and then I look at the individual trees in the forest. So I see the forest, but I see the individual trees in the forest to try to analyze what is happening so that we get to the root of it and solve the problem clearly. So that's how I do it. There are many other nutrients. For instance, people get aches and pains and joint pain and muscle pain and all of these other things that comes along with it. Well, the nutrient deficiencies, if they have magnesium deficiency, they have other mineral deficiencies, they can have aches and pains. But unless you take that into account when you're treating the patients, you're not going to get results. A lot of people don't look at that from that point of view, because in traditional medicine, we're not trained in recognizing a lot of the environmental factors triggering things. We're not trained in recognizing nutrient deficiencies causing things. We just look at the science the way it is, and then we apply it and try to block things, and it's not really panning out.
Yeah, I love that you have that big picture view, the forest, not just one tree. And,
right.
A lot of times we go to the doctor, they like to just treat the symptoms and they don't look much further. They say, well, it's autoimmune, there's nothing we can do, but we can make you comfortable. And I think that's frustrating for so many people.
Right.
So that's definitely good to hear. What are your thoughts on, like, with pregnancy, if your hives go away during pregnancy, like, does that have any significance? Does that mean your hives are connected to hormones, or?
Yeah, that's a good question. So during pregnancy, what happens? Well, during pregnancy, women produce a lot of progesterone. So for instance, if a woman is premenopausal, when she ovulates, she produces about 20 milligrams of progesterone a day. But during pregnancy, the woman produces about 400 milligrams of progesterone a day during the second trimester. So from the second trimester on, the placenta actually helps to produce the progesterone. So progesterone antagonizing estrogen, then these women, their hives will go away, because they don't have a lot of estrogen overload that is causing their problems. And the type of estrogen they produce also during pregnancy is not more conducive to generating the hives. So that's probably why women during pregnancy, they don't have much trouble. And if you look, many of these women, after delivery, they get postpartum depression. Why? Because after delivery, the placenta is gone, the progesterone is gone, then they crash and burn, they get into the postpartum depression. And unfortunately, when we treat that, what do? So, well, you have postpartum depression, we're going to put you on antidepressants. We should probably look at the hormonal imbalance and fix that instead of looking at just the depression and giving it antidepressant.
For women who end up getting hives when they're pregnant, like during pregnancy, does that indicate something else then is going on?
Yeah, it could be anything else. It could be, so for me, I said, well, because of the environmental toxin that we have in our bodies, probably before getting pregnant, women should clean up, right? Because we now know that babies are contaminated from utero.
Mm-hmm.
And for instance, why would you think that a baby will get cancer at 3 months? Well, that's because that baby was contaminated when the baby was in mother's womb. So environmental toxins play a major role, and they can trigger hives, right? So if you have an overload and you do something a little bit, like phytoestrogen, you go and eat some phytoestrogen, you drink even a colored drink, like Kool-Aid, you can get hives because red number 3, red number 40, they're estrogenic. And if it's in your food and you eat it, you get a reaction. And people don't know that. They say, well, why they have a reaction? We don't know. It came out of the blue. I always say there's no smoke without the fire, right? Yeah. Or steam. Maybe some steam somewhere, some fire somewhere. We have to know what the fire is. And unfortunately, we're not looking at the fire. We're not looking at the steam that is bringing on the smoke. We try to put out the smoke.
I love that analogy. That's perfect. So that's really interesting too, because I know a lot of us, that have the chronic hives, our children also have issues like this. So like my 12-year-old and then also my 18-month-old, they both have skin issues as well. So, they say it's not a genetic component. I don't have really a lot of family members who have things like this. And I'm wondering, is it something that I pass on to them in the womb?
That is a possibility because like I said, in general, when you have toxins in you, those toxins get passed on to the kids. And the kids also are in an environment that is toxic. So they're adding every day through the food, through the water, they're adding more toxins. And those toxins may trigger some allergic reaction that we're not taking into account. So when you see your practitioners, if you see the general practitioner, especially, they don't have time. They have 15 minutes and they're not going to go deep and analyzing and trying to figure out the root cause of the hive. So they say, well, this will go away. And many people go to the emergency room several times and still we give them the prednisone and the antihistamines, but it's not getting to it. So they keep on going back and forth instead of trying to figure out what is the root cause. So let's try to clean up the environmental things that are in our bodies. Let's detoxify maybe. And that probably would get a better result than if we did not do that.
Right. Okay, so
nutrients. So nutrient deficiencies also.
Yeah.
Remember, if the kids, a lot of them have iron deficiency. And I can show you since the mid-1990s, if you look, so iron deficiency was flat. Right here, 1997, for some reason, iron deficiency has gone up like a rocket.
Wow.
So you wonder why so many people have iron deficiency. What is going on with this? Mineral deficiency in general, magnesium deficiency, zinc, all of these other minerals, they contribute to some of the factors. That's why I said, when I look at people, I look at 3 things. I look at the toxins, the biologics, and the nutrient deficiencies.
Okay, so if somebody comes to you and they're like, like in a really bad flare, what is your process with them?
Well, so first of all, I have a big questionnaire. And I give them that big questionnaire that tells me everything about their allergies, tells me everything about their hormones, tells me about everything about their nutrition, their diet, what they're doing. So once I have that clear knowledge, then I can tailor the treatment to that. Now, if it's hormonal, I suggest that we do hormone evaluation and treatment. Because what I have found is that many times when we give the right hormone to the women who are suffering, even men too, by the way, they do extremely better. Their hives go away. So because of that, I tend to include the hormonal evaluation and treatment in the process. But the unfortunate thing is if you work for a hospital, many times we have a dichotomy of roles. The dichotomy of role is that we have an endocrinologist who we think should take care of the hormones. and an allergist should take care of the allergies. Well, if the problem is hormonal related and you send the patient to endocrinology, many times they will not evaluate the hormones that do play the role. For instance, they will not check the progesterone, they will not check the DHEA, they're not going to check the estrogens. So they may not be able to cover the bases. The allergists say, well, this is not my field. This is this is hormone thing. So we have a dichotomy, go see the endocrinologist. Then the patient is frustrated because they're not getting results from the allergist. They're not getting results from the endocrinologist. They go to the naturopath. They're not getting results from there. They go to the chiropractor. They're not getting results from there. So that's why I came up with what I call integrative immunity, because I think the endocrine system and the immune system are not two isolated kind of systems. The two of them work together to cause majority of the chronic diseases that we see around. So if practitioners understood very well how the endocrine system works in conjunction with the immune system, perhaps they can help their patients more. So that's how I see it. So when the patients come, then I look at the whole pathways. I look at the systems and see which ones are involved. If I have some sort of autoimmune, I see how we can get rid of it. How can we take care of it? How can we get to the root cause? Is it toxins? Let's take care of it. If it's your biologics, your hormones, let's fix your hormones. If it's nutrients, let's fix your nutrients. Then you get better result that way. Now, sometimes it's a little bit hard because some of this involves lifestyle change. And many times we're so accustomed to our foods and whatever we do daily, when we say, oh, you have to deviate from what you're doing, so then you get results. People say, oh, I cannot do that. That's too much for me and stuff. So then they're not getting the result that they need to get if they had been away from their current lifestyle and adopted the new lifestyle that will help them.
Yeah, that's such a great point. I think that is a really big barrier for a lot of people. And you mentioned before, like during pregnancy, that we want to clean up, but during pregnancy, we also have these intense cravings that are really hard to get through. And then we're fatigued and nauseous, and it's really hard, I think, to kind of fight through that. So that's a really good point.
Yeah.
So what are your thoughts on like a triggering event? Like, for instance, with the pandemic, we've seen a lot of new members who say, you know, I got COVID and now I have hives, or I have the vaccine and now I have hives. What is the relationship with those? That's
a great question. Now, so with COVID, remember the immune cells, the mast cells and the basophils and the 5 cells that I told you about. So when COVID enters the body, or we do injection of the vaccine, who sees it first? Well, we're going to have the antigen presenting cells, those patrolmen, they pick it up and then they're going to show that to the Superman. Now that Superman looks at that and says, well, this dangerous virus is coming. We have all these particles that we don't like. Let's attack it. So then it would go and signal to the bomb making guy who is making IgG, IgM, IgE, I mean, all the bombs that they can make as much as possible. When those are made, especially the IgG, that will go and attach to the mast cell, or trigger the mast cell to release the chemicals. So you will see that a lot of people may have reactions because of the immunoglobulin, or what I call bombs, that are produced due to the virus or due to the vaccine, and that is what is driving the hives. But unfortunately, many times when we look at that, we think basically it's IgE. We're not even thinking of the IgG can be a trigger. And so we're not looking at the whole, again, it's the whole picture that we're not looking at. And that's why we're not getting we don't understand it. Because we see, certainly, like you said, we have a surge of hives due to COVID or COVID vaccinations. And in children, as you notice, a lot of kids that get hives, we call it viral exanthem. Or viral exanthem because they got some viral infection, a cold virus or flu virus, and all of a sudden they have hives. Those are transient because as long as the virus is there, probably they will have 6-7 days. And after that, they don't have it anymore until they get another virus infection. In this particular case, the COVID, people have long COVID syndrome. Who knows? Maybe they're going to get hives all the time. And it could be a chronic hives, but once that goes away, perhaps they don't have it anymore.
Right. So with these people who get these kind of things, obviously, like they probably have something underlying already before exposure, right?
Correct, exactly. So they go overboard. So like if you have hormonal imbalance, that is not fixed. You have some other toxins that are not fixed. So when you get exposed to a virus and they're producing more things that go to trigger your mast cells and basophils to release their mediators, then all of a sudden you're having reactions, and we don't know why you're having the reaction. We say, oh, we don't know, it's idiopathic. Anything that is idiopathic, that, believe it or not, it means we don't know what is doing it. Or we don't know what, in the 21st century, we should be able to know what is causing problems, like high blood pressure. Now, still, many people think high blood pressure is essential. You have essential hypertension, meaning we have no clue what is causing your high blood pressure. There are so many indications that can guide us to understand why people have high blood pressure, if we know it. And that's why integrative immunity really does a great job enlightening people step by step, taking the patients or providers and show them what is actually causing the problem, root cause. Let's address the root cause of the problem.
Right. Yeah, I love that approach because, I know for me that a lot of people, we go to the doctor and we have this like long list of symptoms and they look at us and they're like, you need an antidepressant.
Correct.
It's like, oh, okay. Like it's really discouraging and you feel like, well, maybe I am crazy, and I'm like somehow causing these things, So what is the stress connection?
Okay, so that's a good question. A lot of people, they say, well, you have hives, you have stress. So the stress is what is causing your hives. Well, when we have stress, that has a component in hormonal imbalance, right? So when you get stressed, actually your hormones are not going to work well. Why? Because the stress is going to cause you to produce more cortisol. So if you have more cortisol, then your thyroid doesn't work. So if your thyroid is not working, then you can get hives. So if you already have a thyroid disease, you can get hives. So that's one way you can get that connection. The cortisol itself causes a lot of insulin reactions. So insulin actually causes a proliferation of your mast cells and your basophils. So if you have too much insulin in you or insulin resistance, you may have a lot of hives, and people don't really connect that. So cortisol, insulin, all of those may lead to degranulation of your mast cells, and plenty of them, so then you get the hives as a result. So the stress itself, I hear that of it, oh, my doctor said it's stress. Mm-hmm. Oh yeah, the stress itself, a lot of people have stress, so why don't they have hives?
Right.
That's because the stress is driving some other hormonal things that lead to the hives.
So is an autoimmune disease, like once you have it, are we always going to have it? Or like, is it just remission and we're going to rebound, or can we actually fix it?
Yeah, so back in the old days, if you have an autoimmune disease, well, I personally don't call it autoimmune, I call it immune complex disease, right? If you have an immune complex disease, we say, well, you're doomed. Like if you have a diabetes, we used to think, oh, you're doomed. But we all know if you have diabetes, the number one thing that the doctor says, go lose weight. If you have type 2 diabetes, they say, well, go lose weight so then you can control your blood sugars, right? But the problem is we don't tell people how to lose weight. Same thing for autoimmune diseases or immune complex disease. If you have that, these days, I really don't think it's a life sentence. I really think that if we did the right thing, probably we can get a remission. Why not? Even MS, when people have MS and they did the right thing, they can get into remission. But again, it takes discipline and action. It's a lifestyle change that you need to do to get to your result, but you should do the best you can and fight it as much as you can to get to the results you want to get. And a lot of times people don't have the discipline to do it. They say, well, or also economics, right? A lot of people, they don't have the money to actually buy the foods or the things that they need to get to their results. For instance, if I'm thinking toxins are problems, I would say, well, eat organic foods as much as possible. But these patients will tell me, oh, I don't have money to buy organic food. They're so expensive, right? So what do I say to these people? I cannot really force them to go do it unless there's some sort of governmental help. But here we know that does not happen. In Europe, they actually do a little better socially because the government can actually put in some money to help people buy their foods or do something to help them out. But here, we don't have these kind of processes. You're on your own if you get some sort of condition. Insurance companies, they also don't help any. Maybe insurance companies, if they help the patient and said, we have to put in a lot of effort to help you out so then you don't end up into the emergency room all the time, so that we pay more when you go to the emergency room. Maybe we should do more preventive care. We should give you money or encourage you to do better so then we don't have to pay a whole lot. But they don't think that way. So we end up having all these situations where people are not doing well. But for me, autoimmune does not mean a life sentence. I think autoimmune, we can actually do well. People can get remission or at least minimal, they can get minimal symptoms as they go if they did the right thing.
That's good to hear. I mean, like you said, I know it is really hard for people to take the action. You know what you need to do, but it's hard to take that step and then just stick with it, especially when we have, the way the society is. I mean, when we socialize, we drink and we go out to eat and, all those kinds of things. So that definitely makes it hard on people.
That's correct. Actually, so let me add one thing. For instance, I have patients that tell me, well, when I'm on my own, it's great. But when I go see my family members, how can I refuse the food that they're cooking for me? I said, well, you have to tell them you have a condition that you need to stay away from those kind of foods. So then you don't. And some people say, well, I bring my own food anyway, so it makes it simpler. But some other people may not understand that. You go visit with your friends, they want to feed you. So, well, I cannot eat your food. They may take that as an offense when actually you're trying to protect yourself.
Yeah, it's definitely complicated as far as socialization and that kind of thing. People just don't understand, I find a lot. So,
right.
So speaking of food and diet, is there any particular recommendations that you have? Like, do you do a low histamine diet, or are you just avoiding like those processed foods?
Okay, so that's a good question. Low histamine diet. So again, as you know, histamine is not the only thing that these mast cells and basophils pour out. Although for the hives, histamine is a big one. Mm-hmm. So we have a histamine intolerance. Everybody is talking about histamine intolerance. But when you look at majority of those foods, a lot of them are phytoestrogens.
Interesting.
Yeah, if you look at, there's a cross. So if you look at the histamine containing foods, majority of them are phytoestrogen. So if I'm thinking that estrogen have receptors on the mast cells and basophils, and that can trigger histamine release, then maybe we should focus on the phytoestrogens and not do them at all. Stay away from them. And that's one of the things that I recommend. I tell people, don't do the phytoestrogen, just get rid of it. So then you can get rid of your hives, or you can get rid of some of these reactions.
Oh, that's interesting. So would you recommend that over a low histamine diet then? Just avoiding.
Yeah, I really think that, some of the histaminic foods, like avocados and stuff like that, they may not be phytoestrogen,
Okay.
but majority of them are. So again, you can do a cross. You can look at what is the phytoestrogen and then what is not. Then you can get rid of all of them, and then you'll be probably much better off than not. Again, go to the root cause, fix what is underneath. Is it a hormonal problem? Fix the hormones. And if it's anything else, fix those, so then you may get a better result.
Okay. Right. So if you do fix those hormones and things, then can we go back to eating our food, what we eat now? Or is this
that is possible? That is possible. But again, for me, as long as the environment is littered with toxins, I think if we did go like organic way or grow our own food, we don't put all the pesticides in it, overall health would be better than if we did not. But unfortunately, people do like rotation diet. They say, okay, don't do gluten, don't do dairy, don't do this, don't do that, and don't do soy. So if they don't do that, you feel great, and then you go back to it.
Right.
There's no point, right? If we go back to it, you're going to get the same effect. So that's why I personally don't recommend rotation diet. I say, well, it doesn't help you. If you know that this is causing problem for you, get rid of it. Don't do it at all. In America, we have so much to eat, by the way. Now, a lot of people, though, they eat bread all the time. That's their food. If you tell them don't eat bread, they say, well, what am I going to eat now? You took all my food away. I said, well, there's so much to eat. You have rice, you have quinoa, you have all of these other stuff you can eat. Why don't you just focus on those?
Right.
So, but people always feel constrained because you took the major food away from them. And I think we can do better than that. Definitely.
Yeah. Yeah, I think again it comes down to that socialization and what's easy, and it's so hard to go out to eat and find gluten-free options and dairy-free options, and maybe people feel embarrassed.
Right.
So, but yeah, it's that balancing, your lifestyle. It's like, do you want to be high-free, So it's, or maybe sometimes you cheat, to go out with your friends, but, for the majority of the time you're doing well on your diet. And I think that's important, that you have a little quality of life and you can go and do things, but.
And when you cheat, you will know. For instance, if I say, okay, do estrogen-free lifestyle, and you take all the phytoestrogen, the xenoestrogens, and all of this out of your life. If you go and do it, you will pay a price, right? You will notice that, oh, it's coming. My hives came up when I did that. Then you know that definitely those play a role in the hives, or they play a role in your condition. So don't do it. Just get rid of it.
Right. Yeah, I think it's kind of like a double-edged sword because, on one hand, we really want to be able to take charge and do something about, our condition. But on the other hand, it's like, you feel a little limited, it's like, why,
Yeah. So some people say, I'm so tired of these restrictions. I want to go back and eat my food. I want to be able to do all of this stuff. So my thinking is, many times you can, if you fix your hormones, you fix all the things that are triggering the hives.
Right.
But if you don't, you may not be able to do so. Even when you fix it, it depends. Some of the foods you may tolerate, but others you may not.
Right.
So if you do a bad phytoestrogen like wheat that is already contaminated, and if you eat that, then you may not do so well.
Right. Yeah. So you recommend gluten-free, dairy-free?
Soy-free, more than that, actually. There's so many things we don't even know, like spices and other things that may be contributing to it, but we don't even know that. So we don't take that into account. But if you analyze it and you listen to the patient carefully, which we do in the clinic, I really pay attention when people are talking to me. They say, well, I did this, I did that, and that's okay. That's why when I look at the questionnaire, the diet plays a major role. So I know exactly what they did wrong. And so for
Right.
instance, somebody can say, let me just give you an example. When I was training out of Johns Hopkins, this woman came to us. She said, okay, I live in Baltimore and I have eaten crabs all my life. I eat crabs all my life. I never had a problem with crabs. Last time, I cooked my crabs with Old Bay seasoning, Old Bay seasoning, and then I drank some beer. So I ended up having angioedema, facial swelling, lip swelling, hives. I thought I was going to die. I went to the emergency room. They gave me all this prednisone and stuff. So I think I have crab allergy. So she came to us. We said, food allergy does not take vacation, right? If you eat a food and you get an allergic reaction, every time you eat that food, you're going to get an allergic reaction if it's an IgE mediated, right? There's no if or but. But you have eaten crabs all your life. We don't think it's a food allergy per se. It might be something else. But let's analyze, let's test you and see where you are. We did the skin testing. We did the blood test, everything negative. We say, you know what? The true test is food challenge. You come here, you eat the food in front of us, you eat crabs and in front of us. If you react, we have EpiPens and all of that. We can give it to you and then we know. She went and brought crab meat. Ate the crab meat in front of us. Nothing happened. She did not react. So we said, well, you don't have any food allergy, as we told you. You don't have crab allergy. You can eat crabs. But be careful, have Benadryl with you. And, so if you're having a reaction, you can use your Benadryl and that'll be fine. Years later, when I learned about the hormonal impact on things, I went back, and I always go back to my old patients, things that I saw in the past. So what happened to this woman? Turns out the Old Bay seasoning has phytoestrogen, 5 of them. So this woman is perimenopausal. She has estrogen dominance, and she drinks some beer. Beer most of the time has hops, and hops is a big phytoestrogen. So she ate the crab that is seasoned with phytoestrogen. She drinks some beer that has phytoestrogen. That pushed her over the hump. And then she had big, huge reactions. Was it the food? Well, yeah, I would say the spices and everything else that was in the food caused the reaction, but not the crab.
Right. So that's a really good point too, because a lot of our doctors, people will notice, we'll want to eat certain things or want to eat a certain way, I feel better. And then the doctor kind of says, well, there's no evidence that's true. Go eat what you want, so then they go and eat what they want and they get the hives again,
Right.
But their doctor said that's not what it was. So they're just going to keep doing it.
That's correct.
So
unfortunately, that's the unfortunate situation, because if a doctor is not really trained in recognizing that certain food or spices can cause the reaction, then they're not going to be able to advise that. They're not going to be able to tell you, hey, don't do this because of those spices or those foods. And so if you tell them, I'm not eating that, they say, well, go eat your 10 grains or 10 mixed grains, and that's part of life. That's good for you. But you say, well, every time I eat those, I get reactions. So, this is a fluke.
Yeah.
We don't believe in it. So if you have a discrepancy between your opinion and the doctor's opinion, I say, listen to your body. Listen to what happens to you when you do certain things, because probably you're right, because you know your body more than the provider.
Right. Yeah. And that's definitely, I think, hard for us to do because we view doctors as, the authority figure.
That's correct. But
Yeah.
Unfortunately, not all doctors are trained in everything. And if they're not trained in everything, for instance, hives, allergists will see the hives, or dermatologists will see the hives. But even between the allergist and the dermatologist, they still have different view of how we should approach this condition. So then if you see your primary care physician who has no clue, then it becomes a big difficulty for them to guide you to get to the result. That's why most of the time, the family physician will refer people who have hives or eczema or something to the specialist, who is the allergist or dermatologist.
Right. So speaking of, these different specialists and things, a lot of us have systemic symptoms, like we get headaches and joint pain and brain fog and, GI symptoms, all these different things. So are these all then interrelated?
Yes, they are. So histamine, by the way, we have 4 receptors for the histamine. We have the H1, H2, H3, H4, right? So the H1 actually causes smooth muscle contraction. So you can get abdominal cramps.
Mm-hmm.
Women who even have painful menstrual cramps, if it's a smooth muscle contractor, then perhaps it could cause the uterus to contract so they can get cramps. The H2 can cause acid production in the gut. And so if you get acid production, then you can get diarrhea. You can get all of that. And brain fog, so I think the H3 can also cause the brain fog. So tachycardia, H1, H2 can cause your heart to beat too fast. So you have a lot of histamine receptors all over your body that may be adding to the reaction that you see.
It's good to hear, that it's actually connected, because I think a lot of us, like I said, we get directed to different specialists for different things. We have our gastroenterologist and, our neurologist, and we have all these different specialists, right. And nobody's bringing everything together. So
that's correct. That's why looking at it in an integrative way, that's how you can solve the problem. Because if you look at every piece of the information as a different kind of stuff, then you go from doctor to doctor to doctor, because you see the allergist, so okay, go see the endocrinologist. So you see the endocrinologist, so go see the gastroenterologist. When you see the go see the neurologist, or go see the rheumatologist. So in the end, you have 10, 20 medications, and those medications are also counteracting each other. So you got polypharmacy. You get your heads into the fire. You cannot get out. So it's important for people. That's why I'm personally trying to mentor the doctors also to recognize the whole underlying condition. I call it Integrative Immunity Mentorship Program. And that mentorship program allows people to analyze systematically every patient that comes in the 21st century to understand what is the root cause of the problem and how they can solve it. If it's allergy, they can give allergy things and help them out. If it's a hormone, they can fix their hormones and they do better. So when people start looking at that, even allergists that are mentored, if they start looking at that way, they can see results. They say, wow, amazing. This is totally different. Now I can explain to the patient why they're having what they're having.
Right. So I know you have a workshop coming up. Can you tell us a little bit about that?
Yeah, so we're putting together a workshop to try to go deeper into all of these things. What is causing the chronic hives? What cells are involved? We're going to go deep and understanding it, at least at the layman's level, understand everything that is involved step by step. It's going to be an 8-hour workshop, one whole day. So people who will be interested, they have to budget that 8 hours, and then we can go over everything step by step. It's not going to be only hives, but also all the chronic diseases that we have. People who have IBS, if they have bloating, cramping, constipation, diarrhea every day, and nobody knows, I bet if they come to that workshop, they would be able to take care of that very easily without any kind of problems, because I personally like to give a lot of information. Mm-hmm. I never hide information, because if something is going to help people, I think it's a good idea that they get that information and help themselves. So in the clinic, I spend a lot of time, like probably 2 hours per patient, to try to help them understand the pathways and why and what and how. So on the workshop, we're going to do a whole lot of that. I'll give them everything, toxins, what toxins are involved, talk about the biologics, what hormones are involved, talk about the nutrient deficiencies, all of that. We're going to go systematically and cover it all. Yes.
So 8 hours, that's going to be a deep dive.
Oh yeah, definitely.
Yes,
deep
lots
dive.
of
Because
information.
what I've been thinking is that many times we don't get that. And if we don't get that, even we go to seminars or webinars and all of that, we're not getting the deep understanding of why we have what we have. So we say, well, yeah, I'm condemned to live with my condition for the rest of my life. And actually, there are some ways we can get rid of those things and then have a better life. So my thinking is we can give people a transformation, because if you're chronically sick and you're taking medication all the time and stuff, that's not life. I think that humans, we should be able to get rid of a chronic condition and have a transformation where we feel well all the time. So we will be way up and feeling well all the time, and then we can maintain ourselves there instead of being down here where we have no wealth.
Right. Well, I'm really excited for that. I'm definitely interested, and sounds like we'll be learning a lot and be able to take some action steps away to, help ourselves. So that's really empowering.
Yeah, absolutely. So I think, one of the things that patients complain about is, the number one complaint, by the way, is doctor never explained to me why I'm having all these problems. That means we are all patients, right? So if I go to a doctor and they say, oh yeah, well, you have this, take a medication, go away, I'm not going to be very happy about that. I would want them to explain to me why I'm having this problem. And to do that, definitely you have to go deeper into it. But the 15 minutes visit that we have is not going to help the doctor to educate the patient. So we have to have time aside to try to help the patients understand why they have the condition that they have. So in this workshop, definitely, I think we're going to do that. I have a lot of information that I share. Not only teach the patient, but also I teach the doctors, like I said. So I'm part of A4M. I don't know if you know A4M. It's the American Academy of Anti-Aging Medicine.
Okay.
And I do a lot of presentation for them. When I do the presentation that I do, a lot of time people say, whoa, why didn't I know any of those? These are practitioners, right? Why don't I know any of these? Why now? Why you are the one coming and telling us about all of these things that we didn't have before? So that goes to show, when we train in medical school or nursing school or PA schools, we're not really getting the whole information. And if we don't have the whole information, how can we give that information to our patients? For instance, we don't do environmental medicine, right? So we never learn anything about environmental medicine. When it comes to nutrition, do you know how many hours we spend to learn nutrition in medical school? Not a lot. Even to today, we're not really focusing on those things. So if we don't focus on that, we say, well, food is your medicine. And yet we're not focusing on the foods. So how do we help people heal? Right. So that's why it's important for us to really get to the bottom of it and help the patient understand why they're having the condition they have. And we'll do that during the workshop.
Right. Well, that sounds promising. And that's May 28th.
Right. May 28th, yes. Mm-hmm. Starting at 9 o'clock Central Time, I think.
Yep. And I'll put a link to that too in the description. And then can people work with you locally, or how can people be your patient?
So that's the thing. I see people locally. Unfortunately, telemedicine is great, but because of the state rules, now it is really, even yesterday I was asking my lawyer, what can we do telemedicine wise? Because I'm getting so many people calling me from out of state willing to do telemedicine. I tell them, unless I see you, I cannot do telemedicine. If I see you, probably afterwards we can do it. But if I have never seen you, I have not examined you, it may be difficult for me to do telemedicine. So that's the only drawback. But otherwise, I see patients I can see patients worldwide. I have patients in England, I have patients in the Middle East, I have other patients in other places. We're still helping them. And it's either histamine intolerance, because everybody comes with histamine intolerance, or they're having hives, they're having mast cell activation syndrome, and etc. So I try to do the best I can to try to help these people. So they can see me locally, but afterwards we can do other things.
Okay, so how do they find you? What's your website?
So if they go to my website, integrativeimmunity.com, that is the main website. Actually, I'm redoing it. So if I go there, they may see the old one. But I have another one, it's called integrativeimmunitymd.com and integrativeimmunity.org. So I have the .org, md.com, and integrativeimmunity.com. So the integrativeimmunity.com would be a bigger one. It has all the locations everywhere we are. Because I have 3 locations. I'm in Minneapolis and Sioux Falls, South Dakota, and then Bismarck, North Dakota. But like I said, Minneapolis is easy. A lot of people can fly. I have patients who have flown out, come to Minneapolis, get the visit done, and then they go back the same day. So easy, no problem, because it's a big airport, and then it's easier for people to come and see us.
Right. Okay, so just they have to come for one office visit, and then you're good to do telemedicine afterwards.
Afterwards, yeah, because if I've seen them, I mean, the management, we can do the day-to-day management, we can do over the phone or by telemedicine. We have a good Zoom app, we can do it, and there's a HIPAA compliance, so it should be okay. Yes.
Great. All right. Well, do you have any parting thoughts for us?
Yeah. So I would say that if you have hives, don't lose hope. If you feel by the way, one thing I wanted to add, a lot of people who have hives and stuff, they feel depressed, they have anxiety, they have that. They're all connected though, right? So for instance, if you have too much estrogen, those estrogens have receptors, or the same receptors as your dopamine, epinephrine, norepinephrine on your cells. So if you have too much estrogen, they will go and occupy all those receptors. So then all your good neurotransmitters don't get in. If they don't get in, then you feel depressed, you have anxiety, you have all of that. And during the workshop, I will show you all of these pathways and how they all work. If you have thyroid problems, probably your neurotransmitters are not working because the amino acid tyrosine that makes the thyroid hormone is also used to make the neurotransmitters. So if you have a thyroid problem, so you may have anxiety, depression, panic attacks, and all of that. But we're not looking at them again together to see why you have those things. So it's important. So if you have hives, or you're having angioedema, or you have IBS, or you have a histamine intolerance, or have mast cell activation syndrome, that is not a life sentence. If we know why you're having those problems, then you can address it better. And I hope that we'll be able to help you do so. So if you come to the workshop, that's great. We'll have some recordings also, Sarah, and then probably we may put it up so people can watch it later. But being face-to-face and asking questions. So during the workshop would allow you to ask questions. So if you come and ask questions, that would answer your questions right there. So I think it would be helpful for people to think about that and be able to address the issues better. But please don't despair. I think we have hope.
Yeah, I love that. I'm really looking forward to the workshop and asking you some questions and really taking a deep dive and learning about this. So I appreciate your time today, and thank you so much for taking the time to talk with us.
Absolutely. Thank you so much for having me.